Hello, my name is Simon Berthelot. I am an emergency physician and professor at the CHU de Québec Université Laval, an academic institution located in Quebec City. Okay, I know, I'm just a stickman. Here is my real self. But this guy is pretty boring. So let me take control of this presentation. Ta-da! Magic! I now have the honor to present to you the Value Project! Well, my true self didn't really put much effort into finding this name. Simply put, we aim to compare the value of care provided in emergency departments, family medicine practices, and walk-in clinics to ambulatory patients with acute conditions. In Quebec and Canada, patients with minor conditions are often advised to avoid emergency rooms at all costs and to go to a clinic instead. The presence of these patients in the emergency room is often deemed inappropriate. However, whether patients receive similar or better value when they are seen in clinics remains largely unknown. Decision makers need to be able to identify the best place to treat patients with minor conditions in order to increase capacity either in emergency departments or in clinics. That is why I have gathered a big bunch of crazies like me from 14 institutions in Quebec and Ontario to work on this issue. Hey gang, how are you? In these 14 institutions, we will recruit 4,000 ambulatory patients seen in person or by telemedicine for one of 17 minor conditions such as fever, respiratory infection, or back pain. Our main measures will be patient-centered. We will ask participants to complete patient reports on outcome, experience, and cost measures. Using administrative databases, we will also track and compare admissions, return visits, and mortality between settings. We will apply time-driven activity-based costing to compare the cost for the healthcare system. To date, we have recruited 1,389 participants. The mean age of our patients is 46 years old. Among them, 59% are women, 40% are men, and less than 1% are non-binary. The most common presenting complaints are cough, limb traumas, back pain, sore throat, and urinary symptoms. Our project is an excellent candidate for an award. It will have a broad impact across Canada and worldwide. It addresses a very important questions. Where should we treat ambulatory patients with minor conditions? Our patient-centered data will provide decision makers with the evidence needed to invest in the best care pathways for ambulatory patients. In concluding this presentation, I want to highlight the invaluable contribution of my co-leaders, Dr. Mylène Breton and Dr. Jason Guertin. Thank you all for your attention and enjoy your summit.